It's my great honor to join this session and present our recent analysis on the circadian rhythm of central and brachial blood pressure in relation to mortality risk. We all know blood pressure follows a circadian rhythm, being higher at the daytime and being lower at the nighttime. And in general, the nocturnal blood pressure fall is normal when the nocturnal blood pressure fall is about 10 to 20%. So we call this kind of circadian pattern dipping, normal dipping. In non-dippers, the nocturnal blood pressure fall decreased to less than 10%. And even in those reverse dippers had a higher nighttime pressure than daytime pressure. And we also know that there are a lot of studies, prospective studies, shown that the circadian rhythm of this kind of circadian rhythm of brachial blood pressure was associated with outcome. As shown in this slide, in the international database on ambulatory blood pressure in relation to cardiovascular outcome study, the ADCO study, which involved more than 11,000 participants from 3 continents, European, Asian, and South American countries. And we can see from this figure, reverse dipping was associated with worse outcome, the increased risk of total mortality and cardiovascular outcome. On the other hand, we also know that systolic blood pressure is different along the arterial tree. In subjects with elastic arteries, systolic blood pressure increases from the ascending aorta to peripheral arteries. So we call this kind of this phenomenon as systolic blood pressure amplification. So this kind of phenomenon actually raises a lot of interest on the role of central hemodynamics in the cardiovascular health. So our question is, a research question is, since brachial blood pressure follows a circadian rhythm, is it true also for central blood pressure? Now with advancing technology, it's possible to monitor the 24-hour central blood pressure non-invasively, beat by beat or by intermittent blood pressure measurement. So even together with the brachial 24-hour blood pressure monitoring. So there are several previous studies that have shown that central systolic pressure also follows a similar circadian variation as the peripheral or so-called brachial systolic pressure. So also we can see that the central systolic pressure being higher in the, at the daytime and being lower in the nighttime. However, if we compare the nighttime dipping between central and brachial systolic pressure, we can see that the nighttime dipping of central systolic pressure is a little bit smaller or lower than brachial systolic pressure dipping. You can see from this figure from Williams' study, this axis shows the difference between brachial and central systolic pressure. We can see in the daytime, the difference between brachial and central systolic pressure is about 10 millimeter of mercury. However, at nighttime, the difference decreased to about 6 millimeter of mercury. So it means that at nighttime, central systolic pressure decreased less than brachial systolic pressure. So our research questions are, would this kind of circadian rhythm, the different circadian rhythm of central blood pressure, also be predictive of outcome, like the brachial blood pressure circadian rhythm? And the second is, would this circadian rhythm of central blood pressure could add some value beyond the rhythm of brachial systolic pressure of outcome? So we did some analysis using our cohort in Shanghai. The study population were patients referred to our outpatient clinic of our Ruijin Hospital, Shanghai Institute of Hypertension. And these patients were referred for the 24-hour ambulatory blood pressure monitoring. From the year of 2017 to 2020, more than 32,000 patients were enrolled. After excluding some incomplete or unqualified data, finally, 26,023 patients were included in this analysis. And in this study, we used this mobilograph device produced in Germany to monitor the 24-hour brachial and central ambulatory blood pressure. So the blood pressure was measured every 20 minutes during the daytime and every 30 minutes at nighttime. And the vital status of these patients until December 2020 was ascertained according to the vital statistics of the Shanghai Center for Disease Prevention and Control. And this slide, you can see the baseline characteristics of the study participants. So overall, 26,023 patients. The mean age was 53 years old. The prevalence of hypertension was 88%. The prevalence of diabetes mellitus is 11%. Hyperlipidemia, 32%. And compared to women, men were a little bit younger, but with a worse cardiovascular profile. And this figure shows the circadian systolic blood pressure variation for the central systolic pressure in orange and the peripheral brachial systolic pressure in blue in men and also in women. You may see that both central and the peripheral and the brachial systolic pressure follows a circadian rhythm, being higher in the daytime and lower at nighttime. But the nocturnal blood pressure fall in percentage were smaller at central artery. So this phenomenon was more pronounced in men. The underlying mechanism is still needs to be explained. And we also classify the patients according to the day-night ratio, the nocturnal blood pressure fall. So we classify the patients as reverse dipping, non-dipping, dipping, and extreme dipping. The non-dipping was shown in red, and the reverse dipping was shown in blue. Dipping in green and extreme dipping in pink. You can see that close to 50% of the patients were non-dipping, or non-dippers, and 13% were reverse dipping if we use the systolic pressure at the brachial artery. And this will be worse for central systolic pressure. We can see more patients presented non-dipping or reverse dipping at the central systolic pressure. And if we look at the predictive value of central and brachial systolic pressure dipping status, we can see that both central and the peripheral and the brachial systolic pressure dipping status were associated with mortality risk. The reverse dipping, shown in red line, was associated with increased the all-cause mortality. And in the further analysis, we cross-classified the patients according to their central and the brachial nighttime dipping status into 4 groups. So is concordant dippers, concordant non-dippers, or in concordance between brachial and central dipping status, isolated central non-dippers or isolated brachial non-dippers. And we can see most of the patients, almost 90% of the patients had a concordant dipping status of central and brachial systolic pressure. But still, there are some, about 10% had inconsistent dipping status between central and brachial systolic pressure. So in this population, we had about 8.6% patients had isolated central non-dipping status. So we also examined whether this kind of cross-classification of central and brachial dipping status would be predictive of outcome. And we can see that from this Kaplan-Meier survival analysis and also the Cox regression analysis, we can see that the concordant non-dippers had the highest risk of all-cause mortality, almost doubled risk compared to the concordant dippers. So it means that central dipping status also added something to the prediction of mortality. And we also did some formal statistical analysis to examine the added if the central systolic pressure dipping status would have some added predictive value. In terms of NRI and IDI, we can see that beyond the basic model, even including the 24-hour systolic pressure, we can see that the central dipping status, either in terms of night-to-day ratio or in dipping status, it can improve the NRI and the IDI, means the risk stratification of patients. So our study showed that in these large sample size, the hypertensive patients, both central and brachial blood pressure circadian rhythm predicted mortality risk. And patients with consistent central and brachial non-dipping had a doubled increased mortality risk than those with consistent dipping. So our study highlights that central nighttime blood pressure dipping status might help to identify high-risk patients and improve risk stratification in addition to the brachial systolic blood pressure dipping status. Certainly, we need more study to demonstrate whether such kind of central nighttime hypertension or non-dipping status should be intervened or not. Thank you for your attention.